Hello everyone, I am Dr. KUMAR ABHISHEK, consultant dermatologist from Skin Institute, BHUBANESWAR. Today we are going to discuss about a very commonly asked question, like what should I do for skin whitening or skin lightening? There are very few options available in the market or in medical science which can help you get this result. One of the most commonly used agent for such a treatment is glutathione. So we are going to discuss about glutathione, its uses, its safety, and how it should be taken. So basically glutathione, what it is an antioxidant agent which is otherwise also present within our body, but the oral glutathione that we consume, it is usually extracted from Candida utilis, a fungal yeast. So from that we use this glutathione, we get that glutathione. Glutathione usually exists in our body in the form of GSH and GSSG. And these are the two forms of glutathione which are present in our body, but most important is GSH, which actually imparts this depigmenting property. Yes, glutathione has been found to be effective in skin brightening, both in oral and cream forms. Also, beyond this, it helps in improving the skin texture as well as the elasticity. Glutathione is usually used both in oral and IV forms, but the most recommended and as the doctors advise, it should always be taken in the oral form. The reasons are many, but the most important thing is the safety. There are many doctors who are prescribing glutathione in the IV form as well, but there are no safety studies regarding the IV administration of the glutathione yet. That is why we always recommend to take glutathione in the oral forms. Coming to the benefits of glutathione, glutathione itself is a very strong antioxidant which is always present within our body. But beyond that, it also helps in reducing pigmentation by inhibiting the tyrosinase activity. Also, it acts as a free radical scavenger, so that way it protects your skin from UV-induced photo damage. And also it helps in reducing fine lines, wrinkles. So all these are the properties. Beyond this, it also helps in improving the skin texture as well as the elasticity. Glutathione should always be used with N-acetylcysteine so as to get a better result. Glutathione is available in the market in various forms, be it creams, it may be in the form of face wash as well. And apart from that, oral tablets, lozenges, and even oral sprays. So these are also available. Beyond that, IV form is always present. But out of these, as I told you, the most effective and safe way of consuming glutathione will be oral form of glutathione. What are the natural sources of glutathione? Fresh fruits, nuts, avocados, tomatoes, walnut. So these are the natural sources of glutathione which can give you some amount of natural external glutathione. Coming to the most important aspect, whether glutathione has any side effect. As far as the studies are concerned, oral glutathione is usually the most safest way of consuming glutathione, and it has got very minimal or no side effects. But if you are considering taking IV glutathione, then there have been no such studies, and there have been reports of side effects when glutathione has been taken in the IV form in a heavy dosage. As far as the study is concerned, there has been no consensus, there has been no guidelines regarding what should be the optimum dosing of glutathione in the IV formulation as well. So because of that, there have been reports of skin allergies, skin reactions, even sometimes severe skin reactions like SJS. So even it can cause sometimes whitening of the hairs and white patches on the skin as well. So these are some side effects that have been reported till now. Are the results of glutathione permanent? I would say no, because glutathione is basically an antioxidant which helps you reduce the activity of the tyrosinase and it helps improve the pigmentation. But that is never going to be permanent because the tyrosinase activity is continuous and non-stopping. So once you are taking the treatment, yes, that improves your skin pigmentation and causes a little bit of brightening. But after the completion of the treatment also, we recommend the patient to take a maintenance dose of glutathione so as to maintain the improvement. Because once you stop the medication, there is a possibility of repigmentation of the particular area.